Hello there. How have you been? hmm So, I wanted to do a series on how to manage your mental health, specifically discussing strategies for doing so during Trump's second term. There's going to be a lot to talk about in this video, so in general. So, I'm going to do a series of videos. But first, I just want to acknowledge there are a lot of unique stressors and uncertainties of our current situation. So, for instance, many of us are still dealing with several personal losses, including the loss of futures, of what could have been, um, opportunities, things of that nature, ever since the COVID-19 pandemic. And since then, the landscape of our world has changed so suddenly that many of us are just now coming to terms with what exactly that means. So, today's topic, grief, is relevant not only to personal losses, but also to the collective sense of loss that many are experiencing. It's something that we can focus on addressing right now that can actually help us to manage the struggles of our situation. So let's get into it. First, we need to assess, am I grieving? Let's define grief in clear, relatable language. Grief is a natural response to loss, and it can manifest emotionally, physically, and even cognitively. I see a lot of folks, for instance, who come in who are saying, "Oh, I can't focus. I think I have ADHD." And you get into the history of it, and it's like, "Wow, no, you've you've been grieving a lot." Um, Now, while many expect grief to follow the loss of a loved one, the current political climate can trigger very similar feelings of mourning for a way of life, ideals, and for some, even identity. So, common symptoms of grief include persistent feelings of sadness, numbness, anger, confusion, or even physical symptoms like fatigue and changes in appetite. I will commonly ask people, have you allowed yourself to cry yet? Now, I want to point out to you that you will not find grief itself in the DSM, which, for those who don't know, is the diagnostic manual that we psychologists use. And that is because these reactions are normal. So, in other words, grief in and of itself is not a disorder. There are instead complications that arise from not properly managing grief, such as prolonged or complicated grief, where people experience intense symptoms long after the loss that interferes with their daily functioning. Clinically, when people refuse or avoid going through grief, we often see increased risk for depression, anxiety, or even post traumatic stress disorders, especially when grief is compounded by new or ongoing stressors. There's also a higher likelihood of engaging in what we call maladaptive coping strategies. So these are things like substance misuse, social withdrawal. But we also see worsened health issues, disrupted sleep patterns, and impaired interpersonal relationships. So recognizing these signs is a pretty important first step in saying, okay, what I'm going through isn't normal, and therefore I need to work on managing my mental health better. So now let's cover the treatment outline, if you will. So let's say that for the sake of argument, you identify that you are in fact grieving and you need to grieve, and you've been experiencing secondary complications from not allowing yourself to do so. So, I want to introduce to you the concept of DABDA, as I like to call it. It's an acronym, but it's also a framework for understanding the grieving process. Now, if you've already heard of it, great. I would still say you need to watch to make sure that we're on the same page. There might be some tidbits in here that you weren't familiar with before. But if you're not familiar with this acronym, no worries. I'm going to walk you through each phase, which is denial, anger, bargaining, depression, and acceptance. So, first up, denial. What is it? Well, it's the initial shock where the reality of loss feels simply too overwhelming to accept. Whether it's a personal relationship ending or the sudden alteration of a political era, denial serves as a temporary buffer to help protect us from the immediacy of that emotional pain that we are experiencing. So, this is when many of us were tempted, for instance, to flee to another part of the world, or we just kind of shut things out or down for a while because we were trying to shield ourselves from the emotional pain that we were currently experiencing. Anger pretty often follows denial, which emerges as a response to the injustices and betrayal inherent in loss. So this anger might be directed inward, in other words, toward oneself. So you might, for instance, in this stage, be beating up on yourself for allowing such a thing to happen. It can be directed outward as well. Now, this can be towards immediate people like friends, acquaintances, family members. Can also be directed towards institutions, so news outlets, for instance. In a political context, it can basically just be a reaction to feeling let down by familiar systems of leadership that once provided a sense of stability. And so there's this inherent betrayal, this how could you, if you will, allow this to happen? Next is bargaining, and this is the phase where people try to regain control by mentally negotiating what might have been done differently. So it usually involves internal dialogues or even appeals to higher powers. Uh, it can also involve internally setting conditions, what I like to call if-then scenarios. Like if I'm going to interact with my family, then it's only going to be talking about this, or it's only going to be if they don't say that. And then another thing that can happen is we start discussing what if scenarios. This is to help us regain some sense of control over the situation. So, for example, some might start thinking, okay, if only I had voted differently or campaigned more actively or etc. Or only if more people could have seen this coming, then maybe this outcome wouldn't have occurred. Others might bargain by mentally negotiating that if political leaders reverse specific policies or if new actions are taken, then their sense of loss or grief might be lessened or alleviated. Some may also frame their personal narratives in terms of missed opportunities. So, for instance, they might think that if only they had been more engaged or informed, the political landscape might have shifted in a way that resonated more with their values. These internal negotiations can be a way to cope with an overwhelming feeling of loss associated with the current political climate as we attempt to imagine a scenario where things could have been different. It's an attempt, if you will, kind of like the denial stage to lessen the burden, the emotional impact of what's happening. Once we work through that, we usually enter into a normal depression stage. This is characterized by a really deep sense of sadness and oftentimes despair once the full reality of the loss sets in. So, typically in this stage, we have things like emotional numbness, withdrawal from social interactions, and you pretty commonly will experience, uh, anhedonia, a loss of ability to experience joy in the things that used to bring you joy. In the realm of political or social loss, this can also feel like mourning for a way of life, or the loss of a cultural identity, if you will. I heard a lot of people talk about, I don't recognize this America anymore. And I think they're speaking to that. The thing that I want to highlight here is that this stage is natural. It's albeit painful, that it's a reaction to loss that typically includes waves of sadness, yearning, and introspection specifically tied to that loss. And this is different from a depressive disorder, which is more pervasive, it's more persistent, and it's not, the low moods aren't particularly tied to the loss. With grief, the feelings of despair tend to ebb and flow. So people will still, sometimes, commonly, experience moments of connection or positive memories related to the lost entity. Whereas in depressive disorders, the low mood is constant and it's more pervasive. But once we move through this, and it's important that we do allow ourselves to move through this, we can finally hit that acceptance stage. This is the phase where gradually people begin to integrate loss into their lives. It doesn't imply that people are forgetting or dismissing the pain. That's not what's happening. Rather, they're finding a way to live with it and move forward. In both our personal and broader social contexts, acceptance means acknowledging the reality of change and beginning to rebuild a sense of stability, of some sort of normalcy, even if the process is gradual and ongoing. And that is important for us to do because that normalcy, that stability serves as kind of a bedrock, a foundation, if you will, for us to move forward and try to do things to address the problems that are arising. Another thing that I want to point out is that your grieving process today will likely have several layers. Many people have this preconceived notion of what grief should look like, but the rapid pace of new traumas in the current political landscape is and will likely continue to leave us feeling numb at times and disconnected from these expected stages. In other words, you can think, okay, I've hit the acceptance stage, but then boom, we're right back into a bargaining stage or a denial stage or an anger stage. The important thing here is to give yourself permission to feel all of these layers without judgment, and to acknowledge that we will likely be hopping in between stages rather than progressing through them in a more linear way. So, to help us move through these stages, I think an ACT framework is really helpful. ACT stands for Acceptance and Commitment Therapy. It's developed by Stephen Hayes. I will also link a really excellent book by Dr. Russ Harris below that can give you more information if you find that what I'm covering here today leaves you hungry for more. So, the first thing that I want you to do is to start with mindfulness. I want you to choose an exercise such as deep breathing or guided meditation and engage in this practice every day. Find a time that works for you, set a reminder, and make a commitment to this practice. And this is important because this can help you to notice and accept your emotional experiences as they are, kind of as we were talking about with DABDA. These are normal reactions, and we need to experience them and move through them. And we need to do so without judgment or without this knee jerk or immediate response to change the emotional reaction. Now, if you're new to this, I'll go ahead and provide an outline for an exercise in the description below. So check that out. Also, I want to point out there are excellent apps out there, such as Insight Timer or Calm or Headspace, that offer plenty of guided meditations and even courses to teach you how to do this if you're feeling stuck on this. Next, we want to practice what is called cognitive defusion to help us recognize that our grief-related thoughts are precisely that. They're just thoughts. So, for instance, you might try observing and labeling your thoughts by putting the words, I'm having the thought that, in front of them. So, for example, I'm having the thought that I'm overwhelmed by fears, that my loved ones will be harmed, or more simply, I'm having the recurring thought that my loved ones are going to be harmed. Another thing that we can do is imagine our thoughts as floating leaves on a river. This can help to lessen the grip that our painful thoughts have on us and allow them to come and go more naturally. Next, what I want us to focus on is clarifying our personal values. Um, I'm asking you to reflect on what truly matters to you here, whether it's relationships, creativity, or contributing more directly to a community. Identifying these values can help you to reframe the grief experience as part of a larger life narrative and guide you towards meaningful actions. The next step is then going to be to commit to some sort of small value driven action or set of actions. In other words, I want you to think of one thing that you can do right now, at some point today, even, and take manageable steps that align with your identified values, even in the midst of your grief. This might include something simple like reaching out to a friend, engaging in a creative hobby that expresses what you're feeling, or participating in a community activity that resonates with your deeper beliefs. And lastly, as you do this, I want you to do this while embracing self compassion. Grief is a natural process, but it is a process. It's one that will likely take time. And it's important to be kind to ourselves during the difficult times, especially. Again, this process may not be linear, and small acts of self care are important markers, signifiers, if you will, that we're moving forward. As always, thank you for allowing me to be a part of your journey. I invite you to share your experiences or questions in the comments. Remember, this video is the first in a series of future episodes where I will continue to explore ways with you to better manage your mental health during these challenging times. So, if you found this video helpful and you want more, of course, be sure to like, subscribe, and set notification reminders so that you can be alerted as I release new content. Best of luck.